Executive members of the Public Workers Union are clamoring for the removal of all COVID-19 patients from the General Hospital. They believe that an isolated building should be identified so that they do not endanger the lives of patients and healthcare workers. Public Relations Officer Daisy Hazard says that while they understand that the hospital could take in pop-up cases for screening, placing COVID-19 patients in the same building with unvaccinated persons with other illnesses is a recipe for disaster.
The COVID bays and units are in the General Hospital. Let me say that the PWU is adamant that COVID must be removed from the one little general hospital that we have on island in Grenada. It is a flawed decision in a hospital of our size, with the lack of resourcing, with the lack of specifications to our hospital. And we are saying it is not the best fit in a society as small as Grenada, with all our cultural norms and nuances, to have a contagious, deadly contagious disease being treated right there in the hospital.
As the epidemic takes its toll, elderly Grenadians reflect on the tuberculosis outbreak in Grenada in the early 1900s, when a special center was set up to treat those patients. A tuberculosis hospital was built in 1913 and inaugurated by Princess Maria Louise. Patients were not cared for at the island's main hospital at that time. Hazard says the present pandemic calls that a similar center be established to protect all parties. Last week, Health Minister Nicholas Steele said it was an evolving process and the government was trying to work out a strategy as the situation unfolded.
Familiar with Princess Alice, there's a male and a female section with the administrative and casualty A&E in the middle. So on one side, we have turned that side into COVID. To treat COVID patients, and the other side we have crunched in male and female together there. That will continue as best as possible based on the load.
However, opposition activist Michael Batiste shut down the Princess Alice Hospital idea.
Now's the time that we must find the resources and we must engage the community, the building, the construction industry, and let us set up makeshift centers around the country and stay away from Princess Alice. Princess Alice, as it is overwhelmed.
She says healthcare workers face some acute challenges at this time, and the union is taking steps to assist its members who are designated as frontline workers.
One of the things we are doing now that we've been working on is we are trying to put together a care line for our workers. As to exactly how that will roll out, I cannot say this morning because we are looking at 2-3 models as to how we can provide our workers with some constant support once they need it. And so that's one of the initiatives that the PWU is taking. Another initiative that we're taking is to help provide some care packages to our workers. So, for instance, where they are working on the 12-hour shifts in the COVID bay, we are going to try to provide them with some, tea bags and coffee and stuff like that, some little snacks, and so that they can refresh themselves within the event that they didn't come to work with some lunch, that they can pull something to chew on, as we say in Grenada, and hope that the government will definitely put some things in place.
Ms. Hazard was speaking on GBN's To The Point program. For GBN News, I am Rena Pett Thomas reporting.